Panic stations is usually what ensues when a woman realises that her contraception may have failed in whatever way, shape or form, and this need not be the case because we should be equipped with the knowledge that we need to be able to deal with these circumstances and to be equipped with the knowledge that we need to best avoid these kind of situations. Your healthcare professional provider isn't here to judge you on your circumstances, and the more we talk about emergency hormonal contraception in general, the less taboo it is. Like, honestly, in this day and age, I don't know why it's taboo anyway. We should be able to just have open conversations about it, know our options, and therefore be equipped with the best knowledge possible to make the best decisions. It shouldn't be a mystery what options are available to us. So let's have a little chat today about the morning after pill, emergency hormonal contraception, plan B, whatever you want to call it. Maybe there's other names for it, but we're going to have just a little chat about it today. Before we delve into the topic of contraception, emergency hormonal contraception to be specific, we need to talk about something else which certainly isn't talked about enough, and that is STIs. So with emergency hormonal contraception, it means, generally that a contraceptive method has failed, and if the case is that it is with someone other than your usual sexual partner, or if you and your sexual partner have not had STI tests and you don't know what your status is with regards to sexually transmitted infections, you'll need to go and get a test and just make sure everything is clear. So whilst you can go and get the morning after pill if you find yourself in this kind of situation to prevent pregnancy, it doesn't prevent the transmission of an STI. So unless you know your partner's STI status and their sexual history, that kind of thing, you will need to go and get a test for your own health and safety, because many STIs don't have symptoms, they're asymptomatic, but they can cause problems later on in life to do with your fertility and just your overall health. So really important that you go and get checked if you have had a failed barrier method of contraception, like a condom, for example, breaking, slipping, or not used at all. So that's really important to preface with that before we continue our conversation about emergency hormonal contraception. So now that we've prefaced with a bit about STIs, we also need to talk about whether your contraception actually has failed. So if you're someone who's taking or using a contraceptive method like the pill, either the mini pill or the combined pill. Mini pill is just progesterone only, and the combined pill is estrogen and progesterone. Whether you're using a patch, a ring, an intrauterine device, we need to determine whether your contraceptive method actually has failed. So that's what your healthcare professional will try and determine. And it's something that you can figure out from the little patient information leaflet inside your packet of your pill or your patch or whatever. You can find the patient information leaflet online by going onto like the HPRA website and just putting in the name of your medicine into the search bar, and it should come up then PIL or patient information leaflet. Within that leaflet you'll see what to do if I've missed my pill or my patch comes off or whatever it is, and whether you have a window of say 12 hours, 3 hours. It depends. So some mini pills or progesterone only pills will have just a window of 3 hours, after which if it's outside that window, you normally take it at 1 p.m. and you've remembered to take it at 3:30, you're still okay. But if you remember to take it at 6 p.m, you've missed a pill. So that will tell you what to do, and depending on the week of your cycle as well, it'll have different instructions and different implications. So really important to remember, the riskiest weeks to miss a pill would be your first week and your third week of your pill packet, because your first week comes after your pill break, so your levels of the hormones in the pill are lower in your body and they haven't built back up again, if you know what I mean. And then in the last week you're approaching your pill free break. So if your pill is the type of pill where you take a break, and so that can be a little bit risky as well. So you have to read the information leaflet and see what the best course of action is, and of course your pharmacist can advise you as well. So the first thing is to really make sure that your contraception actually has failed and check out those information sources and speak to like your pharmacist or whichever healthcare professional you are dealing with will be able to help you there. Okay, so you actually have, your contraceptive method actually has failed. So what do you do now? We've dealt with the STIs, we know that that's a concern and we need to deal with that. But in terms of prevention of pregnancy, you have some options. So there are two different types of emergency hormonal contraception. We've got the morning after pill, which is the most common form, and then the copper IUD, which is an intrauterine device, which can be inserted by your GP, for example. And basically, you'll always be advised that the copper IUD is the more effective method, and it can actually be used as continuous contraception, so you can leave it in and it will continue to provide contraception for you. Whereas the pill that you get from your pharmacy or your doctor, the morning after pill, won't protect you in terms of pregnancy for say the rest of the month, for example. You'll need to use additional barrier method, and it's not recommended as a regular form of contraception. So really important to remember that. And also the morning after pill is not suitable for all people depending on their different conditions and different medications that they might be on, and we'll go through that a little bit now. So we've talked about the different options that are available and the copper IUD versus the morning after pill. And the morning after pill is the one I'm going to focus on today because it's the one that's available in pharmacies, and I'm a pharmacy student, and so come across it pretty much every day, which is important to note as well. It's super common and no one thinks you're weird for coming in to get it. More women than you would believe come in to get the morning after pill. And so it's all about just having this open chat and not being afraid, because the last thing you need is additional anxiety that someone's judging you when you're in that kind of situation. So let's remove that altogether. So there's two different types of morning after pill available here in Ireland, and one of them contains ulipristal acetate and the other contains levonorgestrel. So basically with the morning after pill, the key is, I suppose, to get it ASAP, literally ASAP, because time is of the essence. The sooner you take it, the more effective it's going to be. It's as simple as that. With the ulipristal acetate one, which the main brand of that in Ireland anyway, I'm not sure about other countries, is called LO1, and you might have heard of that before. And basically you need to take that within 120 hours or 5 days of the incident of unprotected sex. But obviously the sooner the better. The percentage of pregnancies which are prevented increases the sooner that you take it after the incident. And then with the levonorgestrel based one, there's a few different brands of that, so I won't list them. Basically that one needs to be within 72 hours or 3 days, and it's best taken within 12 hours of the incident. So depending on your circumstances, the pharmacist will decide, or your healthcare professional, whoever it may be, will decide which one's most appropriate for you, and it may depend on the medication that you're taking and a number of other different factors. Again, none of this is intended to replace any kind of consultation with a medical or healthcare professional. It's just to give us a bit of information and to know what to expect if we find ourselves in this kind of situation. And the more we know, the better. So how do they work? Basically, they stop or delay the release of an egg, so they prevent fertilization of the egg by sperm, but they don't prevent implantation, or they can't abort a pregnancy that has already happened. So if the egg is already fertilized, they're essentially ineffective, which is why time is of the essence, and determining where in your cycle you are as well. Obviously, these can't be used if there's any suspected pregnancy. So if your last period was like missed or unusual or late, or if you have any symptoms of pregnancy like abdominal cramp, feeling nauseous, morning sickness, breast tenderness, that kind of thing, you would need to take a pregnancy test, because this can't be used if you are already pregnant, and it isn't effective at aborting a pregnancy basically. So the morning after pill does interact with certain medicines, as we mentioned earlier, and I'm going to put those on the screen now. So your healthcare professional will have to ask you about the current medications that you're taking and any other conditions that you have, as well as any other factors such as if you're breastfeeding, would be important for them to know, because it can affect I suppose your breast milk, you may have to discard your breast milk for keep pumping it and discarding for a week, 7 days, instead of giving it to your baby, because the effect on an infant and whether it kind of transmits through your milk to your baby is kind of unknown. Basically, there's not data available for it to determine if it's safe, as with many medicines in terms of breastfeeding. So unfortunately, that is the case, that you'd have to discard and use formula instead. So yeah, there's a number of different reasons why someone may not be eligible to use the morning after pill, and in which case something like the copper IUD, intrauterine device, would be an option there. So what can we expect in terms of side effects with the morning after pill? Well, it can cause some nausea and even vomiting, and if you do vomit within 3 hours of taking the tablet, you'll have to go back to your pharmacist or whoever gave you the medication, and you'll have to get another one, basically take another dose, or if you have severe diarrhea as well. Some other side effects might be like breast tenderness. It can also affect your next period, so it can delay your next period a little bit, but if your period is delayed more than about 5 to 7 days, or if it's unusually light or unusually heavy, you should speak to your healthcare professional again and rule out pregnancy as well. It can cause painful periods, some pelvic pain, dizziness, headache. Wouldn't be too unusual. Just kind of feeling a bit kind of out of sorts maybe after taking it in terms of your abdominal I suppose comfort. It might cause some discomfort, and then just kind of headachy as well. Also tiredness, it can cause some tiredness. So again, your healthcare professional will go through these side effects with you and explain what you can expect. Not everyone will experience all those side effects, and you might just feel fine afterwards, but just important to be aware of as well. So as I said before, the main thing with emergency hormonal contraception is to make sure you treat it like that it's emergency hormonal contraception and not just ongoing contraception. So it's not recommended to use it twice in one cycle. It's not recommended as a regular form of contraception, and basically if you find yourself in this situation, it's worth having a chat about your contraceptive options with your healthcare professional, and we can cover that another time on here as well, and have a chat about all of our contraceptive options. But this is just such a common request in the pharmacy, I thought it'd be great for us to have a little chat about it. So I hope you found this helpful. I hope that it kind of clears up your, I suppose, preconceptions about this kind of consultation and what they ask you and why, how it works, and how much time you have to, I suppose, act upon this if you find yourself in this kind of situation. And always remember that it's better to ask than not to ask, so if in doubt, definitely do ask. Equip yourself with the information from your patient information leaflet of your contraceptive, whether that's online or you actually have it in the box there, or if you ask in the pharmacy, they'll be happy to give you the patient information leaflet, or answer any questions that you have. So not intended to replace the advice of your healthcare professional as always, but just to share a little bit of knowledge and take the fear and the unknown out of it. So thanks so much for watching, and I will see you next week for another bit of health and pharmacy knowledge sharing. So let me know how you found this in the comments below, or if you have any other questions, and I will chat to you soon. Bye!